We turn to a very serious topic now, post-COVID lungs. There is growing concern that many recovered coronavirus patients, even younger ones, begin to suffer from lung damage months after testing negative. X-rays often reveal the dense scarring that some doctors fear may be irreversible.
We see these types of chest x-rays every single day, and so it's just something that we're starting to notice as a trend is worsening.
Dr. Brittany Bankhead-Kendall says the fact that the lungs are being severely affected by COVID-19 is not surprising.
The type of receptors that COVID likes are really concentrated heavily in the lungs. The largest amount of damage and the most meaningful damage on a large scale is within the lungs.
What is surprising, that X-rays of post-COVID patients who never experienced symptoms often show the same severe damage as those who did.
I've seen those people do okay for now, and then I've also seen those people come back months later and have a collapsed lung.
In another frightening twist, doctors are also seeing post-COVID patients with clear X-rays suffering from severe breathlessness.
They're not showing anything on their imaging, so it's a discordance, if you will. They are unable to climb a flight of stairs anymore. What does that mean for what's happening at a micro level beyond what we can see on imaging? Is there underlying cardiac problems too?
So what's behind the lung damage these X-rays do and don't show? Neurologist Dr. Anna Cervantes Arslanian has a theory.
We think oftentimes, especially in young people, for instance, that it's actually not the direct effects of the virus, but it's the immune response that causes hyper-aggressive inflammations. The effects of the immune system being very revved up is what's causing some of these really catastrophic events that are happening.
So is what's happening to the lungs of post-COVID patients irreversible? The verdict is still out, but with many COVID long haulers suffering from debilitating after effects, Dr. Bankhead-Kendall can't help but wonder.
Will this be the same? I don't know, but certainly the only thing we have to compare it to looks like that too.
Alarmingly, she says that post-COVID lungs look very much like the lungs of long-term smokers. This X-ray of a smoker shows the lungs' healthy black area turning gray, which indicates they're trying to fill with air but can't.
That white is indicative of old scarring, old congestion.
This X-ray of post-COVID lungs shows even less black, more gray, and a lot more fluffy white congestion and denser scar tissue. And while there are too many variables to fairly compare post-COVID lungs to those of smokers,
all COVID lungs that I've seen, even moderate to severe ones, definitely look worse than those of smokers.
While the world waits to achieve herd immunity through vaccinations, doctors are staying focused on research and treatment for all things COVID-related. As for the lungs, Dr. Bankhead-Kendall is praising one treatment in particular.
It really is steroids, and that's really the only thing that we've found over time that's working.
Dr. Bankhead-Kendall is encouraging everyone to get vaccinated, but she says focusing on prevention is still important. Of course, that means washing your hands, social distancing, and wearing a mask.